welcome to SVG-TV News for February 3rd, 2021. I'm Triska Campbell with the details. St. Vincent and the Grenadines on Tuesday confirmed 51 new COVID-19 cases from samples collected between January 15th and January 31st. The National Emergency Management Organization (NEMO) said one case is a contact of an imported positive case, and all of the other new cases were detected during contact tracing and testing for persons with flu symptoms. There are now 910 local cases of COVID-19, many of whom NEMO said are linked as contacts of known positives. 275 persons have recovered from the virus in SVG, 782 cases remain active, and 2 persons with COVID-19 have died. 1,059 cases of COVID-19 have been reported in the country since March 2020. NEMO said all positive cases will remain in isolation until cleared, and all close contacts of positive cases are currently in quarantine. Should contact a flu clinic in their district to arrange testing for clearance. All residents and visitors to SVG are reminded of the importance of consistency of wearing facial coverings, practicing social distancing, and frequent hand washing or sanitization to reduce the likelihood of being infected with the virus which causes COVID-19. Meanwhile, St. Vincent and the Grenadines, Barbados, and several Eastern Caribbean countries who signed agreements with the COVAX facility have been informed of the indicative allocation of COVID-19 vaccines. SVG's allocation is 45,600 indicative doses of the AstraZeneca. This means that SVG can expect to receive the COVID-19 vaccines over the coming few weeks. The vaccines are the first of the assigned doses to satisfy the COVAX agreements with this country. A news release from the National Emergency Management Organization (NEMO) said the COVAX facility has advised that vaccines will be delivered effective mid to late February, with 357,600 doses of the AstraZeneca AZD1222 vaccine to Barbados, Antigua and Barbuda, Dominica, Grenada, St. Kitts and Nevis, St. Lucia, and St. Vincent and the Grenadines. The allocation was determined by the World Health Organization panel of experts and GAI, with the main objective for the countries to begin vaccinating their priority populations as quickly as possible. Minister of Health Sinclair Prince says this development is a significant boost to SVG's fight against the disease and the safety of the population, a transformative complement to the measures already in place for the country's COVID-19 response. Meanwhile, Chief Education Officer Dr. Simone Kizabit said the allocation of 45,600 AstraZeneca COVID vaccines to SVG, with 25% being available in the first quarter, is an extremely important development in the nation's battle to control the spread of the virus in SVG and to return to some level of normalcy. She said even as the nation awaits the actual receipts of these vaccines from COVAX, health officials are cognizant of the need to procure additional vaccines to adequately implement Phase 1 of the National Vaccination Introduction and Development Plan. With the onset of the COVID-19 pandemic, the word quarantine has become a part of our everyday vocabulary as SVG and other countries around the world has put in place measures to prevent the spread of the virus by keeping persons suspected of contracting the virus, including travelers, away from the general population. As conditions became more threatening with an increase in cases of the virus on island, several changes have been made to SVG's quarantine stipulations, moving from solely home isolation to isolating in quarantine transition hotels. Persons coming into the country were asked to book a hotel room and to quarantine for 5 days. This was, however, moved to 10 days, and with an increase in cases and persons testing positive for the virus after their 10-day quarantine, the health authorities moved up the quarantine days to 14. While this might be a necessary way of controlling the spread of the virus, quarantine and isolation comes with its constraints. Reports suggest that there is a correlation between an increase in negative psychological manifestations and being in quarantine. SVG-TV News today spoke with 2 individuals on the condition of anonymity who, upon their return to SVG, completed their mandatory quarantine and tested negative for the virus in the first of the 2-part interview. One of the individuals, a male, detailed his experience and shed light on the personal side of quarantine, the anxiety, depression, and loneliness, which we often hear so little about.
In December, but then I realized I had to spend Christmas in quarantine, Christmas Eve and New Year's and Old Year's. So immediately it took away the excitement. As the days went on, you realize how much it's a drag being by yourself, content with your thoughts. You could become your worst enemy. It was quite an experience. Sitting there in a room by yourself, nothing is more boring and depressing than that. The absence of intellectual stimulation, it proved more difficult than I thought. Being at the hotel was bad. Just the solitude I complained about. But then when I got home, I had to be in isolation from my family, and my family would scorn me like I had the plague. Like literally, they would put food on the balcony and run when I opened the door to come and get it. It was another experience by itself, because you come home being depressed, sitting down in a room by yourself, and then you interact with your family and then they're running away from you, they're avoiding you. That was another strange experience.
In preparation for quarantine, he is advising persons to get reading and other entertainment materials to help their time, noting that the quarantine can be depressing. He also shared some advice for healthcare workers in handling persons in quarantine.
Carry a book or several books, man, because just being stuck there in isolation, you would underestimate it. You would think that, man, I'll just go and relax on the balcony for some time, watch TV and eat some food, but total isolation for an extended period of time, it's not like a mammoth task at the same time, but it's not easy. It's not something you would enjoy. But if you have to do it, you should, because we are assigned a court. We are given a court order when we land here to say that we have to quarantine for 14 days. So we'll be breaking the law if we violate it. When the nurses came to test me, they weren't wearing masks. I found that so interesting, coming pretty close to me, which I found strange. That would be my advice to them, to actually take it seriously too, because they have to protect themselves, and their interaction with other people, they are a risk to me also.
And in light of an increase in COVID-19 cases in SVG, opposition leader Dr. Godwin Friday said it will be best for all ports of entry to be closed for 28 days except for essential travel. During his contribution to the budget debate, Dr. Friday said he understands that the human resource to deal with the disease is overwhelming, and the world help with reducing to high influx of testing and processing of the PCR tests.
That immediately we close our air and seaports to travel, except for essential travel and returning nationals who can get back here. And it's be done for a limited period, starting for 28 days. Let us get control of the spread of the disease in our communities. We can't be compounding the problem every Saturday when a flight comes in with 100 or 200 new people. You have to test all of them. You have to quarantine. Our testing has fallen behind. We've heard stories of people waiting 10, 12, even a senior police officer complained about the backlog in the systems. I know people who are quarantining, and the health officials simply don't have the resources, the time to do the kind of follow-up that they need. So why compound it by having more people come in?
And Dr. Friday said that he is not pleased with the government's response to the pandemic at this current time. And while SVG has seen better luck last year with the virus, this time has been different. He compared SVG to other Caribbean countries, which he said are now doing a better job at handling the spread of the virus by taking measures to safeguard their people. The opposition leader said it seems as though the government is leaving it solely to the people to decide who gets the virus or not by not taking more stringent measures.
Because the earlier the detection, the more lives you could save. But more than that, you can identify where the spread might come from and contain it. It doesn't matter the number. If we can save a life, we save a life. In fact, that is what Prime Minister Motley herself said. We know that most people will recover. The Prime Minister said that. That's the trajectory of the disease. But some may not be so fortunate. And it should not be left to chance to decide and to individual choices, their own initiative to determine who live.
Dr. Friday said the government seems to be fighting the coronavirus from behind. He said prior to COVID-19, many people in the country were already impoverished and has gotten worse. And with more people getting sick, there is nothing to boast about.
They seek to ridicule those of us who call for mandatory mask wearing. In Barbados, it's mandatory. If you don't wear your mask in public, you're fined. They say, oh, you got to find school children, you got to find this and this because a lot of people don't wear it. Well, they don't wear it because it's not required. It's not a mandate. And it's necessary. That's the most important thing that we can do, especially, Madam Speaker, with this threat of the more easily spread variant. From the UK, South Africa, and Brazil, which there was talk, it's a possibility could be here. Don't wait to find out when it's rampant in the community. Let's be proactive. Take the steps now. Madam Speaker, even in this House, mask wearing seems to be optional.
As it regards to quarantine and isolation, the opposition leader said with schools remaining closed, they can be used to isolate people. The government has budgeted $1.5 million for the Milton Cato Memorial Hospital. In his presentation of the 2021 budget, Minister of Finance Camila Gonçalves said that monies will go towards the beautification of the hospital, which will hopefully help to boost patient care.
The truth is that our heavily trafficked main hospital is showing its age. In addition to the program of refurbishment works at healthcare facilities nationwide, Budget 2021 allocates significant funding for a far-reaching program of refurbishment, upgrades, and beautification at the Milton Cato Memorial Hospital. This year, we will spend $1.5 million to conduct repairs on the roof, install new floor tiles, windows, doors, install new air conditioning units, and to give the entire facility a facelift, new paint job, and the like. We are confident that these enhancements will help to improve the overall experience and morale of patients, visitors, and staff alike.
The finance minister said beyond cosmetic, aesthetic, and functional upgrades, modern medical equipment will be procured for the hospital.
The Milton Cato Memorial Hospital will obtain new incubators, patient monitors, and pathology and anesthesiology equipment. New hospital and dental equipment will be distributed to healthcare facilities in Stubbs, Beckway, Kingstown, Georgetown, Bookament, and Chateaubelair. The dengue and COVID outbreaks have strengthened the already powerful case for a state-of-the-art acute referral hospital facility in St. Vincent and the Grenadines. The government of St. Vincent and the Grenadines has publicly stated that we will construct a 140-bed acute referral hospital in Arnesville at the northern end of the decommissioned E.T. Joshua.
Minister Gonsalves said several clinics will also be upgraded and rehabilitated to the tune of $6.3 million.
Budget 2021 dedicates $6.3 million to do rehabilitative work and upgrades at 15 health facilities nationwide. Through financing from the Pan American Health Organization, PAHO, we will upgrade facilities at Georgetown, Barley, Mairo, Stubbs, and Union Island to meet PAHO's SMART standards for resilience, sustainability, and environmental quality. The government will also upgrade healthcare facilities at Calequa, Camden Park, Cedars, Chateaubelair, Cools Hill, Rose Hall, Stony Ground, Chumaka, and Union Island. In addition to its regular community health role, the ENAMS Clinic will be upgraded to a full-fledged wellness center specializing in the treatment and prevention of non-communicable diseases. The unused nurses' quarters there will be converted and expanded into a training kitchen, a health and wellness physical center, and as a model for proactive interventions against diabetes, hypertension, and heart disease.
An update now on the La Soufrière volcano. Lead scientist monitoring the volcano, Dr. Thomas Christopher, on Monday took gas measurements using a multi-gas instrument and filter pack and has reported on the presence of sulfur dioxide, which is the first time the gas was detected as part of the effusive eruption. Dr. Christopher, who is a gas specialist, told SVG-TV News via telephone interview that they are in the early stages of gathering data to determine how much of the gas could be present, but noted that some new changes have taken place with the emission of the gases from the lava dome.
I did when I looked at the data later that evening, I saw the presence of sulfur dioxide, which I have not seen since I've been taking measurements here for this eruption. So we sort of figured in the early part of the eruption that we weren't seeing any SO2 sulfur dioxide because it was being dissolved into the water in a process, well, the groundwater, and that is a process which we call scrubbing. And what we think is happening now is that there's less water. The water is being driven off, and I'm pretty sure people can notice how steamy the emissions are. So you've got less water there to interact with the sulfur dioxide that's coming up, and we think that some of it is actually coming out rather than interacting with the water. So now we're actually seeing it. It suggests that the hydrothermal system is probably drying out.
Dr. Christopher explained that there was always hydrogen sulfide emitting from the volcano dome, which is what some residents in the red and orange zones would smell usually from time to time. He, however, noted that the sulfur dioxide emits when there is magma, which helps scientists to determine the rates of effusion.
So one of the things, or one of the good things about being able to see sulfur and measure sulfur is that we can get a flux, a mass flux for sulfur dioxide, as in how many tons of sulfur is coming out on a given day. And as the plume matures, we should be able to do that from the sea using a boat, which makes it a lot safer in terms of exposure. And I think we're happy in thinking that if we can get a good constraint on the sulfur flux, then we can have a good idea of what the magma extrusion rate is, given that the gas is coming out of the magma and there's a fixed amount of gas in a fixed volume of magma. So the more gas you're seeing means the more magma that's degassing.
Sulfur dioxide in large concentration is considered a major air pollutant and has significant impacts on human health. Dr. Christopher said they continue to monitor the dome, and today they were at the Belmont Observatory as the weather did not permit his team to visit the volcano summit. And the National Emergency Management Organization, NEMO, is reminding the public that no evacuation order or notice has been issued and continues to appeal to the public to desist from visiting the La Soufrière volcano, especially going into the crater, since doing so is extremely dangerous. NEMO said it will continue to provide regular updates on all activities taking place at La Soufrière. Meanwhile, in the event of an evacuation order due to a possible explosive eruption at La Soufrière volcano, Area Representative for North Windward, Montgomery Daniel, is not in support with using schools for evacuation shelters. The communities in North Windward are in the red zone of the volcano. During his contribution to the budget debate in Parliament yesterday, Daniel is also Deputy Prime Minister and Minister of Transport and Works, said the schools are to be converted. If schools are to be converted to evacuation shelters for residents in the red and orange zones of the volcano, it will cost the government at least $600,000 for each school. Minister Daniel told the Parliament that it is unfortunate that the leader of the opposition made the suggestion of using schools to evacuate as evacuation centers, noting that they should make better suggestions that are workable and real.
Infrastructure where they are today, to convert them to anything close for any shelter is going to cost the government on average $100,000 per school. And if one school is to hold approximately 500 persons, it means you need at least 40 schools to hold 20,000 people. Immediately you're looking at $4 million. I mean, we need to really make suggestions that are workable and real.
The North Windward MP spoke about his experience of the last volcanic eruption in SVG in 1979, noting that the country is in a better position to provide evacuation shelters for 20,000 people.
I might be one of the few persons who would have experienced both eruptions in 1971 and 1979. At that time, the very day when the eruptions were on, people were moving and going anywhere they could have find safety. But thank God that this government is already in the process of organizing and putting in place things that can be safe for an evacuation of 20,000 people all across St. Vincent and the Grenadines.
Opposition MP for South Leeward, Nigel Stevenson, called on the government to free persons who have been imprisoned for ganja and to expunge their records. Stevenson told Parliament during his contribution to the 2021 budget debate that he has been pleading for this since 2019. The opposition MP said, as the state is now benefiting from the medical marijuana industry through the granting of licenses and other fees, the government should wipe the records of persons who plant, smoke, or sell marijuana so that they could get a clean police record when seeking employment.
But the people who have kept that going for all these years, making the sacrifices, living in the homes, sleeping in tents, in shanties, dodging bullets from police, jumping over cliff like Tarzan on ropes, to keep this industry going for over 50 years. Those I have been arguing, Madam Speaker, are the people who should be considered first in any legal marijuana farming.
Stevenson said a traditional farmer should also be considered first in legal marijuana farming in SVG, noting that they are the ones who paved the way for SVG's medical cannabis industry.
Part of this as the Minister of Agriculture, selling to foreign investors that St. Vincent and the Grenadines is an ideal place to come to grow cannabis, medical cannabis, because we have over 50 years of experience. Who have over 50 years of experience? The traditional farmers, those who over the years have had to leave the comfort of their own homes because their economic circumstances largely were not ideal. They can't find jobs. Some of them have been socially excluded. And birds of a feather flock together. They find like minds and go into the hills, and they continue to plant this marijuana.
The opposition MP said that it is not that traditional farmers enjoy engaging in illegal activity, but they are forced to do so as a form of providing a living for themselves and families.
But since we are going there as a government to benefit from something that these people have sacrificed so much for, why not reach out to them? And I'm asking, and I'm making a very strong play on the behalf of those persons who are involved in the marijuana trade. I'm making a very strong request of this government, because I've heard that those persons who are locked up in prison for marijuana now, surely they were not an incubator of the coronavirus. You see, Madam Speaker, but the coronavirus reached them in prison. I'm asking this government, I don't know how that works, but there are people here who know better than me. See whether or not some of those persons who have marijuana convictions can have their sentences commuted.
And the SVG medical marijuana industry saw the opening of the first dispensary, Green Lava Labs, at Bentic Square in Kingston last December. To assist with fostering a greater understanding of who will be able to access the products offered at the cannabis dispensary and the process involved, SVG-TV News spoke with Executive Director of the Medical Cannabis Authority, Dr. Gerald Thompson, who said persons will need a cannabis card, and he outlined the 19 qualifying conditions for getting this card.
First, patients have now been applying through the process of patient access to receive medicinal cannabis for an illness that they might have. And we have identified some 19 illnesses with some other illnesses that are on reserve: multiple sclerosis, severe intractable epilepsy, a form of fits, autism, but it also can be used for post-traumatic stress disorder and for anxiety, for glaucoma, sickle cell pain, and for sleep disorders, chronic pain, Alzheimer's, Crohn's disease, one of the bowel disease, hepatitis B, Dravet's disease, and severe depression.
Dr. Gerald Thompson said persons will be granted a medical cannabis card by their certified physician, after which they can take the card to a certified dispensary to get their prescription filled. He said the card will be valid for 1 year, while the prescription will last 30 days. Dr. Thompson said this was done in an effort to control the access to medical marijuana products and to prevent any misuse that might interfere with SVG's aim to be transparent and properly regulated to strengthen its exports capabilities.
I think that we are obligated to ensure that there isn't any form of misuse of the system where persons, a young person gets somebody to do it for them, or one person is buying for many people and selling over and all that sort of stuff. St. Vincent is a destination that is export oriented. We certainly have a major plank in relation to providing patient access and the availability here in St. Vincent. But in terms of from a production point of view, being able to export is going to be considered as the primary source of revenue. We have licensed a number of companies, and they are in the process of also engaging local and traditional cultivators to produce, with the intention of being able to process into oil or use carefully dried product to be able to export.
For persons in the local markets and for those visiting our shores, Dr. Thompson said there will also be an online process whereby persons will be able to access SVG's medical cannabis products.
Persons can come to St. Vincent, and there's a process by which we are in the process of setting up where they could actually be able to get prescriptions filled online. And this is, in this COVID era, it has accelerated this process. So persons, it doesn't have to be a touch kind of situation, but doctors can examine and approve patients online, and additionally, patients can receive a temporary ID card, so online, and they can bring it to a pharmacy and contact a pharmacy, one of these pharmacy dispensaries that have been approved, to be able to pick up their product.
There is likely to be a further increase in fish landings for 2021 here in SVG, which will help to create a developmental strategy and framework to benefit fisher folk and the country on a whole. So says Minister of Agriculture and Fisheries Saboto Caesar during his contribution to the 2021 budget debate in Parliament yesterday. Minister Caesar noted that during a 9-month period last year from January to September, there was an increase in the weight and value of fish marketed when compared to the same period in 2019.
Marketed in St. Vincent and the Grenadines up to the end of the third quarter of 2020, January to September, has shown an increase of 34% in weight and 22.6% in value when compared with the same period in 2019. The estimated fish landings amounted to £2.6 million, generating a total revenue of $16 million. None of this was possible if we didn't have the Argyle International Airport. During the same period of 2019, fish landings were estimated at a revenue value of $13 million. And the chief planner in the ministry has noted that once this trend continues, there's likely to be a further increase in fish landings for 2021.
Caesar said that fish and fish products exported from SVG last year has shown a significant increase of 40.8% in weight and 71% in value.
And I really want to take this opportunity to commend the stakeholders in the fisheries subsector. I can remember many evenings you had young persons from Bequia, from Union Island, from right here in Kingston, Kialiakwa, and Oya, having consultations as to how we can lift our game. They were young men, products of the education revolution, going online, finding markets, whether in Hong Kong, in Miami, in New York, and having meetings all over the world to ensure that there was a market.
The Agriculture and Fisheries Minister said with the coming on board of the Rainforest Seafood Ministry, the ministry will see an increase of over a further $20 million market for fish and marine products in this country.
That with carefully planned and crafted policies by this government, that we are creating opportunities for the young people of this country, and I know that they are satisfied with the work of this government. By the end of 2021, not only will we have fish processing facilities in Union Island, in Bequia, in Owia, in Barely, but we will have 2 in Caliacua, 1 by Rainforest, and we are working on advancing the infrastructure through a public-private partnership of the government-owned fish market there in Caliacua.
3 communication arms of the government, the Agency for Public Information, API, VC3, and the National Broadcasting Corporation, NBC, are expected to operate soon under a merged entity. This was highlighted in Parliament yesterday by Government Senator Rashad Bala, who has responsibility for information during his contribution to the 2021 budget debate. Bala noted that from the 3 entities, there are 73 employees who will come together as one under the merger entity. He, however, noted that the only position budgeted for will be a chief executive officer to head the entity. He also noted with the alignment entity, the workers will be divided into various departments such as TV, radio, print, and internet.
This individual will head the editorial board, serve on the board of directors, and exercise general managerial authority over the TV, radio, print, and internet divisions of this proposed amalgamated entity. NBC and API would retain their existing general manager and director, and they would be responsible for managing the day-to-day activities of those entities under the supervision of the CEO. Now, the CEO will ultimately report to the Minister of Information. Madam Speaker, an amalgamated organizational structure would facilitate editorial and administrative consolidation.
Senator Bala highlighted the ways in which this new merger entity would be efficient.
Create a common editorial board to coordinate messaging and share information and avoid duplication. 2, it would consolidate sales, marketing, accounting, IT, and technical staff into single units to increase efficiency. It would create a print division to reactivate the already established publications such as Focus magazine, which was established since 2005, as well as write press releases and focus generally on the production and editing of written content. 4, it will create a new internet and social media division to hone in on producing and refreshing content on the government website, as well as maintain, refresh, and produce content for YouTube, Facebook, and Instagram and other social media handles.
He noted that within the first 6 months, the amalgamated entity should have a non-exhausted list of programs.
Expand the range of API-produced material. Madam Speaker, in the first 6 months, the amalgamated information entity should have what should be a non-exhaustive list of programs. And we have been brainstorming a number of them. For example, a morning show in the likes of, I don't know if any of the honorable members usually look at American news, and they have a morning program on Fox called Fox and Friends, and there's Morning Joe and stuff like that. That is one idea. Another would be magazines and programs that are focused on material, including things based on sports, human interest, material, culture, politics, religion, etc.
The SVG police force said it is investigating numerous reports of what appears to be a fake job offer. The police said a post is currently being circulated on Facebook advertising job vacancies on behalf of Kanawan Beach Resort for positions of bartenders, waiters, and housekeepers. The post encourages persons to call 534-0875 and ask for a Mrs. Marshall. The police said the public is strongly advised not to call the number provided in the post, as this is a bogus scam by the individual or individuals to possibly lure vulnerable and innocent into exploitive situations. Persons who may have called the number are asked to contact the police at telephone numbers 457-1211. That's 457-1211. One male suspect is in custody assisting the police with the investigations.